It's a real disappointment for me as a community care doctor, as a GP, to have to charge out-of-pocket gaps to keep my practice viable. I truly wish that I was able to provide free universal healthcare to all patients that come to my doors. But at this current stage, in order to keep my practice open, we're needing to charge increasing out-of-pocket fees. So we're really looking forward to the outcomes of National Cabinet.
What impact is that having on some of your patients, the fact that they have to fork out-of-pocket fees?
Out-of-pocket fees aren't new. Many patients do know that that out-of-pocket fees are required for some, if not all, consultations for certain individuals. But they're feeling the burn on their pocket. It's meaning that patients delay their care and present to the urgent care or an emergency department to get the care that they need, or they're simply not coming at all. And 2 years down the track, they're having a really significant life event, like a heart attack or a stroke.
Okay, National Cabinet's meeting today. We have already had a discussion about Medicare rebates being raised. Obviously, that's something you favour. How much should they be lifted, in your view, to help practices like yours, particularly in country areas of Australia?
Look, we need substantive reform to the healthcare sector, and that includes Medicare and healthcare funding reform. Simply raising the Medicare rebate alone is likely to not bring us into the healthcare system that we need today. If we were to raise the rebate, say by $30, that may cover most additional consultations for patients to afford their care. In another 20 years' time, we'll be exactly stuck where we are if those fees aren't indexed. So we need comprehensive reform that enables better access in a 21st century healthcare system that sets us up for the next century.
What about the idea being floated by the government, potentially pharmacists being able to prescribe medicines to help ease the strain, ease the burden on GPs?
One of the recommendations from the Medicare Task Force is to enable multidisciplinary care. That care should be stewarded by a general practitioner to enable better access. The Rural Doctors Association of Victoria supports better access to pharmacists, potentially with some limited prescribing abilities, but that's working in a comprehensive team together with a general practitioner to enable better care for patients.
And the fundamental issue going forward, that's cast our minds now, Dan, forward 10 years, 20 years, 30 years' time. Only 16% of medical graduates at the moment want to go into general practice. How do we increase that? How do we make working as a GP in the city and in the bush more enticing to young graduates?
We do need to make the career of general practice awesome again. Take us back 30 years. 50% of graduates were entering general practice as a specialty area of medicine. There needs to be comprehensive reform, and that begins all the way prior to entering university so that individuals know that this is a career that's attractive and that they might want to enter. In university, those medical students are exposed and taught by specialist general practitioners. And then when these junior doctors enter the workforce, there need to be not only financial but also career incentives to encourage those doctors to move into general practice and particularly come and work in the bush with me.